Well, first of all, thanks for joining us, Neil. I know it's a very busy time, a lot of concerns out there. It's been about 4 days since the new measures were really put in community. How's it going so far?
You know, I'm delighted to say that we have really good compliance from everyone. Everyone realizes they need to do their part. Everyone realizes they need to contribute. And in that regard, I'm excited by the compliance we're seeing. Of course, we have the police out there. We have our community service officers. Our method is really to inform, educate, and let people know that, in fact, this is not only good for them, but it's good for the rest of the community. So there's not only pressure from us, but there's really a lot of social pressure to comply at this point.
How worried are you right now about hospital capacity?
Well, right now we have, of course, Twin and Boise that are within range, and so far they have capacity to deal with the overflow situation. So critical care cases are being sent to Boise and Twin Falls, but you know that's really a hospital question and not a political question.
What do you tell those who worry right now that maybe concerns about health are overriding concerns about the economy?
Well, that's obviously the balancing act that we're doing. We want to make sure that we're addressing health issues, but we're also addressing economic impact. And, you know, economic impact can have health impacts of their own. The stress that it puts on families, families going hungry, families not able to make their payments, all of this may not manifest itself with a virus, but will manifest itself with other health complications. And so we're balancing that. And so that's one of the reasons why we set a clear timeline for the halt on construction. We wanted to say, look, we're going to put a halt on construction, but we're also going to get construction back on operating on the 13th of April. That's the plan so far. Of course, if the data changes, we'll have to reassess. But at this point, we really want to let people know that, yeah, you'll be getting back to work on that. Now, of course, there's also the state order that's in place until the 15th. And I imagine they'll be coming under some sort of pressure to extend that to at least to the end of the month. That allows essential businesses to continue, but then other businesses cannot. And so that'll definitely have an economic impact if it goes through April. Again, you know, we are a tourist economy. Typically, April isn't a very busy month for us. And so we're used to quieter time now and in May. But, you know, if it goes beyond that, then there's serious implications for the economy of our valley and and economic health of our citizens.
You're a small community of about 2,700, somewhere around 3,000 people. Does that make dealing with this in any way easier? Because things like maybe even down the road, more testing that might be done can be done more easily with a smaller population.
Right. So we're on the front line in terms of Idaho and in terms of the country, but we're also kind of a manageable size of population. So I'm able to address every email or every phone call that I get from a population. We can also be used as a test case for other populations going forward because it is a manageable size. And so we're hoping to increase our testing and increase, you know, not only the testing of whether you're positive or negative, but also whether you have the antibodies. And so we're moving on all these fronts to try and put ourselves out there as a test community for other health professionals to use as a model for other communities as it continues to spread through the country.
Are you considering any new measures right now?
Right now, no. We're not. We're considering just maintaining what we have. And you know, so far the data that's coming in is encouraging, but we need to see more. And so again, what we're doing is saying let's shut it down. Let's shut it down for these 2 weeks, and let's see what the data says at the end of this 2 weeks, and see if there are any other actions we should take to either increase it or relax it. At this point, I anticipate that after the 12th of April, where we'll be going to the statewide order and following that for the remainder of the month.
One last question. What's your message to, you've made your message clear to your community. What's your message to other communities?
Other communities, look, I think getting people to realize that it's not only themselves they hurt, but they hurt the rest of their community if they don't abide by the guidelines. And so we'd encourage people, other communities, to keep their social distance, to observe the rules that are in place, because we're helping each other out. And borders don't matter. What matters is health and humanity. And I'd really encourage everyone to think about that.
Neil Bradshaw, the mayor of Ketchum, thank you very much for your time. We really appreciate it. Stay well.
Thanks so much. Appreciate the time.